Indonesia's COVID-19 situation is currently a worst-case scenario, according to a government minister. Earlier in the week, the country surpassed India's daily totals of coronavirus cases, registering more than 56,000. The uptick in cases has been blamed on the more infectious Delta variant, first identified in India. Worst hit are the islands of Java and Bali. Some hospitals here are having to turn away patients because they don't have capacity and enough oxygen. The government has imposed newer, tougher restrictions to control the spread of the virus, but for some, it's already too late.
The last rites performed for a victim of Indonesia's new devastating wave of COVID infections. A team of volunteers support the police in retrieving the bodies of those who died at home. And there are more and more of them. On the first day, we only received a call for one death. On the second day, there were 3 deaths. But today, a week after the group was formed, there are 7. So the situation is getting worse. Many of those who die at home simply weren't able to get a hospital bed. The explosion in COVID cases has left wards overflowing with patients. Some of them have to be treated in makeshift beds in hospital hallways. Experts say that the government failed to take adequate measures to prevent this crisis.
The government also reported that Delta variant or other variant also everywhere in Indonesia, in most of the districts hardly hit by the COVID-19. I would say that this is more or less India situation, and maybe could be even worse.
And like in India 2 months ago, oxygen here is also starting to run short. With many COVID patients being treated at home, there is huge demand at this oxygen filling station. The pandemic has forced me to come here and buy oxygen for my mother. She's sick with COVID, and I'm trying to give her oxygen therapy at home. Most people here are buying oxygen for infected people who can't be treated at the hospital, and they have to care for them at home. So far, only around 6% of people in Indonesia have been fully vaccinated, but vaccine deliveries are finally picking up speed, raising hopes that this latest explosion in cases can eventually be curbed.
And joining me now from Jakarta is epidemiologist Dr. Pandu Riono, who's been monitoring the COVID crisis in Indonesia. Dr. Riono, welcome. The situation has been described by a government minister as a worst-case scenario. Could it get as bad as India?
Yes, the pattern of the increasing cases is like India, you know. We got, since start early June, the increasing cases is very fast and almost step up like vertical increasing. It looks like the India patterns of the increasing of cases. It means that also we got the same problem like India, that our healthcare collapsed because all hospitals already full. People who got who want to do got taking care, and also have difficulty to get the oxygen. We got a crisis, the oxygen deficit, you know, because all the patient demand for the oxygen, and also many hospitals run out of hospital because we got demand, increasing demand from the people who got infections. And also another problem is we run out of bed, ICU, and also the drugs for taking care of the patients.
Everything that you're saying is what happened in India just about a month back. I wonder, therefore, if Indonesia did not see this coming.
They see this coming, but they don't know they will hopefully not like India. And that's why the problem is we are waiting until we got the last, finally we got the increasing cases. Actually, we could prevent it as early as possible, like before Ramadan or Idul Fitri festival. we got a lot of massive mobilizations in Java, from Jakarta to Java Islands, and at the time also we already got the Delta variant, but still not dominated. After the massive mobilization during Ramadan festival, the increasing Delta dominate in our country, then we follow the increasing of the cases. It means until now we cannot controlling the pandemic because these Delta variants and also the late response from our government to stop the to social restrictions. It means that that's why it's very worst scenario will coming in the near future.
Now, this spike in cases, as you correctly point out, is also because of the Delta variant. You're an epidemiologist.
Yes.
Can you tell us what we know about this variant? Why does it spread so fast and why is it so deadly?
Yeah, because in Delta variant, actually we already identified since January, and then we see the old variants like old virus still dominate, and then after March will be increasing more because we'll look at the ends of March already tipping of the infection in some city. And it means that now it's become dominated because we find out the transmission is 2 times or double than before, and also the increasing of fatalities. It means that this variant is very, very dangerous because we cannot stop the pandemic, stop the transmission. Even in one person's got the infection, suddenly and all the member of household in the household will be also got infected and die. And also the problem is the hospital cannot accept the new patients. Mostly is now people dying in their home and also dying in the emergency room.
Right. We'll leave it there for the time being, but thank you so much for joining us today, Dr. Riono.